Hello, I'm Eric Crump, Aerospace Program Director for Polk State College Aerospace Program. Welcome to the Expert Series. Today my guest is Dr. John Frasier. He's going to talk to us a little bit about medicine and airplanes and how they overlap and sometimes maybe how they shouldn't. So John, thanks for coming and talking to us today.
Eric, it's my pleasure. Thank you for inviting me.
Absolutely. Well, tell us a little bit about your background. What got you interested in aviation, first of all?
I was born in Scotland, in the north of Scotland, and my brother was actually a navigator on the what's called Coastal Command that keep the seas clear of Russian submarines in those days. So we used to go down to the airport with him and watch him fly and get involved with stuff like that. But I didn't actually fly at that time.
That's probably good.
That was a good idea. Eventually I went to college, studied to become a doctor, and then came to Chicago where I became an orthopedic resident at the University of Chicago. Did a fellowship in Boston, which was a wonderful experience at Harvard and Tufts, and then arrived in Florida and spent about 20 years here in practice over in Pinellas County, which is Clearwater area. While I was there, due to the beautiful weather and the multitude of aircraft flying in the skies in those days, was talked into buying an airplane before I could actually fly. So there was about 5 of us, 4 of which were already flying, got me to buy a 1/5 share of a twin Comanche.
Oh, nice. Okay.
So
And did you learn to fly in the twin Comanche?
No, I
Okay, I was about to say that's a pretty intimidating airplane to learn to fly in.
Yeah, well, I used to fly it when one of the other guys would be assisting me, as it were, to use a medical term.
Right.
But no, I did it. I learned to fly in a 172.
Okay.
And then transitioned into the twin. Passed that test down at Naples Airport with the guy who checked out the Eastern pilot. So I felt pretty good about it.
You felt
myself.
pretty good about
Yeah,
that?
I did.
I can go fly for the airlines now.
Yeah, I was just about ready. And then did my instrument rating in both aircraft, and then went through a bunch of different airplanes. We had the same group of guys bought a Cessna 340, which was a nice airplane to fly.
Oh, yeah.
I bought my own Bonanza to have just for pottering around in. And throughout all this time, of course, I had a pretty busy practice because I was the first Board Certified Orthopedic Surgeon in basically Largo area.
Wow, okay.
With about 100,000 people and me.
Right.
So
you stay busy.
Yes, and part of the nice thing about having an airplane was 2 big things in my life. I'll back up a bit. Getting your private pilot's license, because you could kind of go places, and the mobile phone, the Motorola mobile phone, the one as big as a brick.
Right.
It meant you could actually take that airplane and fly to Lakeland, and if there was an emergency, you could be back in 15 minutes because they've called you on the mobile phone. So people with broken arms and stuff could still get fixed.
Right.
But it gave me that little tiny bit of a release from the prison of work and the hospital in those days.
So it's actually kind of a nice little escape for you then.
Absolutely.
To get out, see the world
Yes.
from a different perspective.
Yes.
You can't see sick people from 8,000 feet. It all looks pretty from up there, I guess.
That's
right.
correct.
Okay.
Well, the option is, as a doctor or a surgeon, if you're on call, as I was at that time, 24/7. You either get a powerboat and this big mobile phone, or you get an airplane and an even bigger, and the same mobile phone. But
Right.
there's a radius that they could safely go. But Lakeland would be fine because it's only 20 minutes from PIE,
Right.
or maybe down to St. Pete or Sarasota. But there's a bit of leeway. But
Sure.
it did make you a human being, whereas sitting home just waiting for the phone to ring, which it did, it makes you a kind of dull person.
Right.
Yeah.
Okay, I'm sorry. I'll be to the OR in just a minute. I've got to land the airplane. So.
Right.
So tell me, from your experience, of course you're obviously an accomplished surgeon and also a pilot as well. So from your perspective, what medical factor or limitation do you think generally pilots are the least cognizant or aware of? Some limitation of just the human body or the human body in flight that maybe pilots are least aware that really affects them?
That's a good question, and having not sat a whole bunch of pilots down and asked them, it's a difficult one for me to just to give you the out-and-out answer. But I would say the limitation or problem that you don't want to have is the one you don't know about. People who have a heart problem know they've got a heart problem. People who have usually a mental problem know they have a mental problem. If you can't breathe,
Unless they're in denial.
that's true. That's true. But if you've got a problem with your lungs, you can't breathe. So, getting down to brass tacks to answer your question, it's the things that you don't really know you have that I think is probably the most limiting deal, and that would be something involving life, involving flying in that kind of milieu. So as far as people not knowing they haven't had enough sleep, people not knowing that there's too much going on in their life, people not knowing that head cold that you've taken the NyQuil for, that's not a good idea. So I don't think I can give you one specific answer for that, because I think it may change as your own situation changes. But certainly things that you don't recognize, to me, would be the biggest limitation. And sometimes it takes a real friend or a visit to a physician or even a therapist of some form to tell you, well, I don't think I think maybe you are stressed a bit. Maybe that is having an impact on your life. Things that are going on in your life, whether it be an emotional problem or maybe a money problem or something like that, it can affect you very much so.
So to some extent, you're saying that some of the mental attributes of just living as a human being, some of those things that we take for granted when we're walking along on the street, are things that can seriously impair us when we're in an airplane.
In an airplane and in the operating room.
Yeah, there's certainly a tie.
It's difficult to switch off completely, just to focus on something that you think you do very well. You think that everything else is on the sidelines when you're flying that airplane or when you're operating on that burst appendix. But it doesn't work that way. There's the fine points of stress and the fine points of what's going on in the rest of your life. You just can't get away from it. It's always there.
Right. So at what point, as a surgeon or as a pilot, you're obviously familiar with the high pressure environment of being in an operating room where someone's life is on the line, or obviously operating in an airplane. I'm sure you found yourself in some dicey situations that maybe you didn't expect, were some things that were unplanned. And you're also certainly used to long hours and lots of stress and the fatigue that comes along with that. You said it's almost impossible to shut it off. So how do you deal with that? Because there's still a job to do. There's a mission to accomplish. How do you compartmentalize those different areas of your life? And when you get to a point where you're unable to do that, what do you do about that?
Have you got 2 hours to answer that one? Thank you, Eric.
Right.
Well, when I interview surgeons who are coming for a job at my institution, this is one of the questions I ask them. If you were standing at the sink, washing your hands, getting ready to go operate with your boss, and you detected a medical situation with him, whether it be alcohol on breath or something along those lines, and I always say, what would you do? And that puts a heck of a lot of stress on these guys who are here for an interview. They don't expect you to ask that question, but I think something along those lines is important. And if they want to get the right answer, basically, they say, "Excuse me, sir, are you okay?" And if the other guy says yes, then I think they need to go speak to the medical director. So getting back to your question, I think it's nice if you're flying in an airplane where it's a team game. If there's a left seat and a right seat, I think the other guy should not feel intimidated, especially if it's the captain, in making a call, even although his call may not be something that takes the captain out of the seat. If he's concerned enough to make the call, you got to make the call. And I think that's something that people have to learn. Do not be ashamed or afraid to ask the question. So before we get into the rest of your question, I think that's very important. Do not be ashamed, because I think in medicine, just like I'm sure in aviation communities, there'd be a feeling, well, if I say something, oh my goodness, it's going to mean the end of my career in this airline for the next 20 years if I say something. But it might mean the 200 people in the back of the airplane live on that flight, or it might mean that the person I'm operating on, or the guy who's being questioned is operating on, gets off the table. So in aviation, it may well be a multiple of 200 versus a multiple of 1 in medicine. So I think that's a question that nobody should be afraid to ask. Is he okay?
Right.
Is he okay? Because if he's not, something needs to be done, and that's not your problem, that's somebody else's problem.
Right.
Can't remember where we started with this, Eric.
That's fine. That's fine. And I guess, so in the taking that a step further and looking at the single pilot environment,
Yes.
when you're trying to determine, okay, yes, I'm stressed out because I have these bills coming due and I don't know where the money is to pay them. Some type of, life event that's not just a, well, and there's always the, I'm not as rested as I should be, but am I still safe? Where is that boundary? I guess the follow-on or the concluding part of that question is, how does a pilot, especially in a single pilot operation, know that they're medically, mentally, physically qualified to get in an airplane and go flying? If you don't have that guy sitting next to you saying, are you okay?
Yeah.
What is the process? What is the process that you go through before you get in an airplane and go fly to determine that you're qualified and ready to get up and perform that operation?
Well, there are the guidelines that everybody knows, the I'm safe type deal, but unless you've had previous experience of when you were safe and when you were unsafe, where is the line? I think it's a great question, and I think it's something that would be nice that you could plug yourself into a machine and the machine tells you the answer rather than you having to make the decision.
Right.
Because sometimes humans are not so good at making tough decisions.
Right.
But I think if you're the type of person who's fairly straightforward and is not on medication, doesn't have any pre-existing conditions, and that's been the way you've been for years and years, if all of a sudden you've developed something like, let's get something simple like the flu, well, common sense should possibly tell you that maybe it's not a good time to be flying, because changes in altitude, changes in aircraft position can affect things that the flu can upset. So I think it's a very difficult question to answer. How do I tell myself I'm okay?
Right.
And I don't have a great answer for you.
No, that's fine. I think that's an important point to make, though, because it's not always easy. There isn't just a machine we can just put our finger in and say, okay, yeah, you can fly today, or you can't fly today. The risk assessment tools that are available, of course, you have the same sort of tools available in medicine to determine if, is this a medically necessary procedure that we're going to perform? And then also, do the risks outweigh the possible benefits? Sometimes it's you actually have the possibility of doing more harm by operating on a patient than you would to not, or to treat it with some other way. So in aviation, with the risk assessment processes that we have through I'm Safe is a good example. One of those things you can file away in your brain. But also, one of my favorite is the risk propensity indexes, which goes back to the first point you made, and I guess we can wrap it there, is that it really does come down, at the end of the day, in my opinion, maybe you share this, to your mental attitude and the way you approach how you fly. Do you want to be safe, or do you want to take chances? And there are people who are just more prone to risk behaviors, and then there are people who are completely risk averse and who are afraid to go outside. Most of us fall in that middle ground somewhere, and depending on our life events, we tend to sort of go toward one end of the seesaw or the other, depending on different situations. But I agree with one point. Well, I agree with all the points you made, but I agree specifically with one point you made where you said that that it's an individual choice, that you will choose to be safe, to ask, are you okay? But it really comes down to that mental attitude and where are you, emotionally, physically, mentally, all that. Where are you, and is your attitude safety first, or do you just say that because it sounds good?
Yeah. Well, before you close, I'm just going to say, normally what we do is we play to our strengths. Everybody likes to play to your strengths, and that's flying when you're healthy and in great shape. And what I would say in medicine, what we do then is play to your strengths also. You operate on the conditions that you know you really know how to operate on really well. Now, what I do, if I've got some weaknesses, you've got to train for your weaknesses, which means go ahead and fly with a bunch of other guys who are better at one thing than you are and keep doing that particular maneuver or whatever it is until you gain proficiency. The problem is with being sick or having a sickness or an illness or a situation of stress, fatigue, it is so difficult to train specifically for that condition to make yourself competent with the condition.
Right.
That is why, as you say, you've got to make the call. Am I safe or am I not safe? And if you make the wrong choice, it's not usually very good.
And you got to be willing to say no. Sometimes
Absolutely.
the answer is just no. We
Absolutely.
don't fly now. We fly later. Or we don't fly today, or whatever it is. But sometimes it's just better to say no than to put yourself in a situation. John, thank you so much for your
Eric, it's
time.
been
Appreciate
fun.
it very much.
Thank you.
Thank you for your attention to the Expert Series. Please check back regularly for more segments with extremely qualified people like Dr. John Frasier. Thanks. Have a great day and fly safely.